Okay, I do this video for people who came out of comas, okay? And if you come out of a coma, okay, high blood pressure is going to make you have a seizure, which potentially could cause death. And if you come out of a coma, okay, it is highly recommended that you drink water, because water will help keep your blood pressure down and prevent you from having mental health problems and serious events like seizures, and which could potentially lead to death if your blood pressure gets too high and it stays high and it doesn't come back down again. Another thing that potentially could help you with blood pressure after a coma, right, is breathing exercises. Okay, and breathing exercises does take a tremendous amount of patience, and it does make you feel retracted from society afterwards, but I mean, unfortunately, when you come out of a serious event, generally speaking, you feel retracted from society regardless, because people didn't help you, and that's the reason why this event happened, which is why you're having to do these things, and which is why they don't offer a breathing therapy for people who came out of serious events, and which they should offer, because high blood pressure is the thing that is going to kill you. And another thing that they aren't offering, which they should, is a tube in your nose that puts water in your mouth so that you are constantly hydrated, because when you come out of a serious event that makes you fall unconscious because of a loss of blood, your hydration level has gone down, and that lack of water contributes to high blood pressure, which depending on certain factors, okay, if you exercise every day, okay, then your blood pressure can go up and come back down really quickly, okay. But if you don't exercise, okay, your blood pressure will go up and it will stay up, and high blood pressure is what's killing people. And when you come out of a coma and your blood pressure goes up and it stays there for a prolonged period of time, it makes it so that the high blood pressure pushes blood out of the region of the brain where that the damage was done. And then once the blood is pushing out of this one region, once the blood is pushed out enough, then your body will stabilize itself if you survive this, and you will come out of the seizure and you will be able to function again. But it will have an impact on your emotions and your focus capabilities, not to the highest extent that you won't be able to focus, but to an extent that it will have an impact, and particularly in relation to others who hold bias towards anyone who has anything happen to them that is not considered normal, such as having seizures after a coma or coming out of a coma in the first place. But blood pressure is a very serious event, and if you come out of a coma, if you do not exercise every day, if you do not drink a lot of water, if you do not do breathing exercises, right, you are at high risk of having seizures and health problems, because your blood pressure will go up a lot easier than somebody who has no damage done to their brain, which a coma is the cause of this event. And blood pressure and comas are very serious events. And if you do not exercise, and if you do not do breathing exercises, and if you do not drink a lot of water and focus on low blood pressure, there is a good chance that if you do certain things such as skydiving, okay, which if you come out of a coma and you do skydiving, there is a good chance that you could die, because your blood pressure will go up and you could die in midair, and your blood pressure wouldn't come back down again. Another thing that very likely could kill you when you come out of a coma is scuba diving. Okay, this is a prone thing that could kill you, right? Because when your blood pressure goes up and you're underwater, you obviously have no chance of getting out of there in time, right? And another thing that potentially could kill you, right? Well, not kill you, but a thing that could cause serious danger to you if you do not practice monitoring your blood pressure with breathing, exercise, And drinking a lot of water, right, is having sex, right? And if you have sex, there is a good chance that your blood pressure will go up and you will have a seizure during sex because your blood pressure will not go back down again, which is a very serious thing. And it's happened to me on multiple occasions and had tremendous consequences on lifetime damaging events, which no one ever came to terms with. But I have to turn the other way when I'm thinking about these people. But if you ever come out of a coma, right, the most important thing that you ever need to do, right, is monitor your blood pressure, which is another reason why these sirens that are driving by our place is endangering my life, and I'm not appreciating it because it is making my blood pressure rise, which is making it so I suffer from trauma, from my brain bleeding, because it is making my blood pressure rise to a level that is, especially keeping a person awake also makes their blood pressure rise. And blood pressure is the number one killer. That's the big deal. And if you come out of a coma, right, you need to do things that are going to keep your blood pressure down, okay? And that's the most important thing. And when I came out of this coma, they never explained blood pressure, and it was actually a very serious event. And it had tremendous consequences on all of my relationships, and people are very, very, very without compassion to that of another person, and taking Valium and things like that is not going to help, okay? That is a false belief that this is helping you. The thing that helps you is keeping your blood pressure down. And if your blood pressure is down, you won't get angry. And when you get angry, your blood pressure goes up. And that's why the best thing you could ever do, right, is exercise, jog around the block every day, right? Drink a lot of water, right? Do breathing exercises. I know there's people who know more too, but blood pressure and comas are a death sentence, and they should do more to inform people about the dangers of high blood pressure and coming out of a coma.